Hello, my name's Charles Catridge. I'm the CTIO at Bath Health and the Clinical Engagement Lead for SNOMED International. It gives me great pleasure to introduce Nick Hardiker from the International Council of Nurses and Jane Millar from SNOMED International, who are going to describe what's happening next in supporting nurses and nursing practice globally using our terminology.
Thank you, Charles. Hello, Jane and I, Jane and I'd like to talk today about a recent agreement made between the International Council of Nurses and SNOMED International. But perhaps more importantly, we'd like to talk about the benefits that the new arrangement is going to bring. So, as you may know, WHO designated 2020 as the International Year of the Nurse and the Midwife to coincide with the 200th anniversary of Florence Nightingale's birth. But unfortunately, COVID-19 overshadowed somewhat the celebrations. But COVID-19 has actually brought into sharp focus the key role that nurses and nursing play in the prevention and management of the disease. So we've always known that that good nursing care makes a positive difference to individuals, to families, to communities, to populations. But what it really lacks is consistent, reliable data, both to inform practice, but also to make visible the contribution, the kind of unique contribution that nursing makes within healthcare. So in the first part of this presentation, I'll talk briefly about some of the challenges that are driving the increased need for nursing data, and I'll take as examples two very recent publications. The first one is the World Health Organization's State of the World's Nursing Report, which argues essentially for greater investment in education, in jobs and in leadership. And the second resource is ICN's own COVID-19 call to action, which highlights 12 imperatives for nursing and nurses in light of the pandemic. Both of these were published earlier this year. Then Jane will go on to talk about what ICN and SNOMED International are doing together to tackle some of the issues. We know from various studies that if we increase the number of nurses and if we educate them better, we also increase the quality and safety of care, even reducing mortality. The WHO State of the World's Nursing Report provides supporting evidence about and policy options for the global nursing workforce. It covers a number of areas, all of which rely on good data about what really happens in practice. I'll take each of these themes that I've pulled out in turn. So good documentation is a really important foundation for delivering the best possible patient care, not least in terms of continuity. Secondly, knowing what makes a difference and what doesn't perhaps make a difference, maybe using aggregate information provides evidence for good investment decisions. Thirdly, I'm astonished really at how leaders and managers in nursing do their job so well in the absence of good information about what nurses observe and what they do. And finally, working across geographical and professional boundaries is now the norm. Again, it's something that relies on information that's accessible to a range of people. Turning now to ICN's COVID-19 call to action. So as I mentioned previously, it highlights 12 imperatives. The text is very small here. It's available online though. It highlights 12 imperatives for nursing and nurses. Many of these imperatives also rely on good data. Things like infection prevention and control, test, track and trace, and also supporting an extended scope of practice, so pushing the boundaries of what nurses can and can't do. There's overlap here, of course, with the World Health Organization report, for example, around measuring and valuing nursing and nursing care. So ICN's already taking steps to ensure that good data for and about nursing is collected, aggregated, analysed, and importantly fed back to be used in decision making across the profession and across the service. ICN publishes and has published for over a quarter of a century the International Classification for Nursing Practice, ICNP, which ICNP is a terminology that's been developed specifically for nursing, and it's already used in a number of countries and settings. It's a related classification within the World Health Organization family of classifications. It's published in 18 languages, but despite these benefits, it lacks a global reach. This obviously impacts on its ability to inform some of the big decisions about nursing, which I talked about previously. Also, it's unidisciplinary in nature. Necessarily, it's about nursing. It covers nursing, but this provides a barrier potentially to greater multidisciplinary working. So this year, ICN and SNOMED International have taken a brave step to collaborate in helping to increase the uptake and use of nursing terminology globally by expanding its existing partnership arrangements in the form of a new agreement. I'll pass over now to Jane, who will talk through in more detail this new approach, talking particularly about the next steps and the benefits that this may bring.
Thank you, Nick. As Nick has mentioned already, what we're doing now between SNOMED International and ICN builds on what we've been working on previously. The two organisations first started working together formally in 2009. And what we worked on then over a number of years, culminating in releases in 2016, so it was a number of years, was equivalence tables between SNOMED CT and ICNP for nursing diagnoses and nursing interventions. And those equivalence tables have been available since 2016. But there was a real need to move further forward to help with further integration so that nursing information could be derived from the electronic health record, which was always really one of the drivers for the equivalence tables, but to try and do it seamlessly and help the vendors who've got systems, electronic systems out there, be able to have an integrated solution. So what we're moving towards now as part of this new agreement is incorporating the whole of ICNP into SNOMED CT. There may be some content which won't go into SNOMED because it isn't clinically relevant or other things, but we'll be ensuring that we can manage that. And that is what we're actually working on now. And the principle of the arrangement that we've got is that ICN will continue to own ICNP, and that is key. SNOMED International is not a clinical organisation, a clinical body. ICN is the clinical body that needs to manage what is in ICNP. SNOMED International will retain ownership of SNOMED CT. So we still each have got ownership of the products. There is within SNOMED CT, as many of you know, a lot more content than is in ICNP that nurses can use, and that will remain the same throughout. We know that. But actually, it might help to feed into ICNP further content over the years. ICN will continue to lead on ICNP development over time. It will do quality assurance and governance of it. That is the key thing. SNOMED International will not take that over. All that SNOMED International will do is maintain and distribute ICNP on behalf of ICN. That is key to this agreement. So ICNP will be available through SNOMED International. And there is no commercial agreement here. There is agreement between two organisations, but no money moving between the two organisations. What we see looking at how we're operationalising this agreement, what we're working towards now is reviewing and including new content into SNOMED CT in line with ICNP 2019, which was the last release of ICNP. And as you know, those who use ICNP has been produced every 2 years. Within SNOMED CT, we will release the ICNP content as a reference set. So it will be released as a separate product, as well as being integrated within SNOMED CT. So it'll be released as an ICNP reference set in RF2 format to enable the systems developers who are developing electronic health records to have an integrated solution that enables the nursing to use both SNOMED and ICNP. And we are aiming at the moment, and early work, which has already started, indicates this is certainly a feasible target. We are aiming to release the first reference set in 2021, post-July release of SNOMED International edition. And we expect to reach that target. So actually, there will be 2-year space again. The product ICNP reference set will be free for use in SNOMED International member countries. And we are putting in place licensing arrangements working with ICN for usage in SNOMED International non-member countries. And as many of you know who know about ICNP, they've always had a licensing arrangements which they have managed, and they will continue to manage that, but with some support from SNOMED International from a technical and information perspective. SNOMED International has a nursing clinical reference group, an international group, and that group will, working with ICN, will have some input to the work which is going on in getting the content into SNOMED CT, giving us a sanity check, a sense check to make sure that what is going in is relevant to the electronic health record and the clinical end of information. And that, again, we actually have a project group at the moment which combines SNOMED International and ICN representatives actually doing the detailed work. And then we're working with the larger reference group. So coming back, September 2021 for the first release of the reference set. And after that, we will do an annual release. Now, that annual release may initially just be an update based on content in SNOMED CT and any amendments there have been as part of normal quality assurance, etc. But ICN will then decide when they want to add content to it, whether they continue on a 2-year cycle or whether that becomes an annual cycle. And those are discussions we're having at the moment, and that is key. There is much more flexibility now as we go forward. Benefits. I think Nick talked about benefits, and he and I have worked together since 2009, really. And it's one of the big things we've seen is the benefits of this partnership between SNOMED International, what was previous, also IHGSGO, and ICN. It does help with increasing nursing usage of agreed terminologies. And I think this move will make it even better, because we certainly are getting inquiries now at SNOMED International about ICNP. I'm getting them on a regular basis. How is it integrated? How is it working with SNOMED? We have the answer now, and we can deliver it easily to people's doors. I think I want to say, and this goes back to the previous slide, because I don't want to forget this one, that we will initially also release an equivalence table, which enables those who have been using ICNP 2019 and previous versions to enable them to move to the use of SNOMED International in electronic health records when they're ready to. So we will be producing that equivalence table. It would be a one-off because to enable that move, but just filling that little gap in. We're hoping that it will give enhanced reach of ICNP out into a global community and global access through electronic health records. And then we hope that this will reinforce for SNOMED CT support for nursing content, both the ICNP content, but also the other content which is in SNOMED, which supports nursing care, care of individuals, both in the acute sector, the healthcare sector, but across into community and the social care sector. What we have found over time is that through discussions, as happens when you're trying to work with two terminologies, it involves a lot of discussion and has influenced the quality of both ICNP and SNOMED CT. It's challenging often to integrate two terminologies. Well, it's always challenging in my experience, but because of that challenge, it makes you really think about what these terminologies mean, and therefore it enhances the quality and gives benefits to the end user. What we're doing as well is avoiding duplication and providing integrated resource that supports implementation of both SNOMED CT and ICNP. And by having more regular releases and access to it, over time, as we talked about before, we can become more responsive to changes in practice. And we already try to do that in other areas of SNOMED CT. And I think this will be a big benefit to nursing as we go forward and as nurses use the electronic health records more and more, but also want to derive nursing specific information, as Nick referenced earlier. And this will make more visible the nursing contribution to patient care. And that is key, as it is for many other healthcare professionals. So that's what I wanted to say at this point in time. And I would encourage you to participate if you're interested. And the key way to do that is through our nursing clinical reference group. And as we go forward, we know that there'll be more and more involvement from nursing. And we want to encourage that through ICN and participating in other work that is being done at SNOMED International, such as with diabetes, social determinants of health, functioning, etc., where nursing has a key role to participate in. Thank you very much for listening.
I think we're on live now, Nick and Jane. So thank you very much for a great presentation, very interesting, and we've generated all sorts of questions. I'm going to take them from the top of the list, but they have been shared with the audience. The first question is about creating ref sets out of the ICNP, and a question about whether that will be modeled in OWL later on. Do either of you happen to know that?
I can take that. We quite rightly, the questioner points out that ICNP is modelled in OWL. That's the underlying framework. I think anybody that has done work around OWL will know that the mapping between two different OWL representations is a challenge. And so what we're doing is hopefully the mapping that has been done, the modelling that has been done will assist in the authoring into SNOMED CT, but there's no intention to retain the original OWL representation of ICNP except as a legacy product.
Thanks very much, Nick. Jane, there's a question here about being a member of the nursing CRG and whether you have to have a sort of an ICNP, a badge of honor, in order to join. Do you have to?
No, the nursing clinical reference group is open to all, and we're discussing all sorts of topics, anything. Obviously, with a focus on SNOMED CT, because it's based at SNOMED International. But we do want to encourage people to come to that group. As you know, there's in the networking lounge, we do actually have a particular area where you can discuss a particular topic around exploring SNOMED CT and nursing terminologies. A lot of you have been to that. And from that, I think we will be having a meeting of the nursing CRG in November, where we can start to pick up some of these threads of discussion about what SNOMED CT should be doing about linking to nursing terminologies, what is required, as well as the discussions about particular reference sets of SNOMED CT to support nursing, things like that. So please use that forum, but also contact Nick and I, and please register for the nursing CRG, and you definitely don't have to be a user of ICNP. But overall knowledge of nursing terminologies is what we'll be picking up there, both at different levels. So please, if you're new to the area, please come along. It's not just for experts, it's to come to learn and discuss. Thank you for that. That's a good question. Thank you.
Great, thank you very much. And then there's another question that comes from Belgium, from Katrine, about the relationship between ICNP, NICNOC, NANDA, and SNOMED, and is there a route map to including NICNOC, NANDA in our collaborations with SNOMED CT?
Nick, do you want to deal with the first part of that one?
Yeah, so I'll talk about the ICNP side of things. So we've had various kind of collaboration agreements with various terminology development organisations, and that's resulted in mappings, for example, with the clinical care classification, amongst others. I think that we have to treat that now as kind of legacy products. Some of that work will assist in terms of future mappings, but I'll leave Jane to talk about the relationship with SNOMED CT and other nursing terminologies.
There is no formal relationship with NIC and NOC, but we are talking at the moment to NANDA, and in fact NANDA and who have responsibility for NANDA, and they are quite keen for us to put some content into SNOMED CT, and are actually, as we've started the ICNP work and integration of ICNP into SNOMED, they are sort of following the path with us. So if there's any corresponding content in the set, there's only about 70 or 80 that we are probably going to add, because quite a lot of their content exists in SNOMED, because it's, these are clinical words in many cases, and so the SNOMED CT, as you know, has got a lot of content in it which is usable by nurses regardless of whether it's come from NANDA or come from ICNP. There is a lot of content in there which has come across from CTV3 in the UK, which had a huge nursing project, and other sources. So that's the position at the moment. But if anybody, this is what I want to do in the nursing CRG now, is actually get some picture of whether there's any requirements for a linkage and what those use cases are. So please come along and talk to us.
Could I just add to that, Charles, please? So one of the great benefits of the relationship between SNOMED and ICNP has been to kind of assure nursing content. SNOMED has far more content than ICNP, obviously, and far more nursing content than ICNP. But one of the benefits is that we, within that bounded space, we can have some assurance that nursing content does exist in there. So if people did feel the need to do any mapping or terminology binding, for example, then there's a greater chance that the content is already there, and so it should facilitate some of those processes.
Right, thank you, Nick.
I think we've come to the end of our session, so thank you very much. Great answers to some great questions, and I'm sure the conversations can continue beyond this conference, so thank you all.
We've got another 5 minutes, I think, and there's a couple more questions. Is there not one that's just appeared? Oh, no. Okay.
Well, Miko has said, can we all meet in Finland?
Okay.
We'd love to. So when traveling is allowed again,
yeah.
we'll go to Helsinki. There was a question that I thought about earlier, Jane, which is how can we really support nurses to use EHRs and SNOMED implemented in the EHRs?
Carry on, Nick.
Yeah, so I've been thinking about this a lot through my career. Actually, it's a conundrum. I think the easy part is deciding on a terminology. Bizarrely, it's taken 25 or 30 years to kind of move in that direction. But that's where the hard work starts in terms of thinking about nursing practice and actually how electronic systems can best support nursing practice. And I think that's where the effort should be now. I think the kind of replication of paper records into electronic systems isn't working out too well for nurses, and also the kind of siloing isolation isn't working out too well. So these are just personal reflections, and I think it would serve as well as a profession to really seriously almost start from a blank sheet and think, how. So we've got systems, how can we best support practice and make sure that practice is integrated within the kind of enterprise. So yeah, I think the challenge, I've been very focused on terminologies for my career, as many other people have done, but actually now I'm here, I kind of think, well, that was kind of easy. All we had to do was agree. And now some really hard work needs to be done in terms of how do we make those systems fit for nursing, and so that they best support ultimately better healthcare. There are good examples where it is it's not all doom and gloom. There are examples where it is in the chat in the networking lounge there was a chat about how Finland are using a nursing terminology, and it's mandated to the use of summary information, as it is in Portugal. Portugal is a place where nursing documentation is paperless, has been paperless for a decade or more, and it's a place where physicians also consult nursing documentation, which we can't say it happens globally. But I think the positive thing is that we are, as a community, coming to agreement on some of the fundamental kind of architectural features like terminologies, which means that we can finally start to get stuck into some of the harder challenges.
I don't have anything to add.
That's great. There's one final question. One final question about validation of nursing diagnoses and whether SNOMED CT can be used. So I know the answer, but Jane, do you want to answer that, or I, or both?
You can answer that one because you've got practical experience.
So I think the simple answer is yes, but obviously you need a system for capturing the diagnosis, and then a system for auditing and validating. So it's a question of input and output, and human methods and computational methods for checking. But yes, SNOMED CT can certainly be used. So I think we do need to close down now because you will want to switch to other presentations. So can I thank Nick and Jane very much for a very interesting presentation and an invitation for us all to go to Finland in a few months' time. Thank you very much.
Charles, I will be dropping into the networking lounge in the nursing area, and as will Jane through the day. So if there are further questions, follow-up questions, then we'll be there.
Yep.
That's great. Thank you very much indeed.
Thank you.
See you in the networking lounges then. Bye.